Let's make sure we never miss another question about Cryptococcus neofromans. So what do we need to know about this? It's an opportunistic fungi. It's a fungi, like me, has thick polysaccharide capsule that inhibits phagocytosis, can be seen and is associated with pigeon droppings. Humans can become infected by breathing the air that's created when cleaning the droppings. It also produces urease. That's kind of cool. I feel like I'm describing like my friend, like I'm pitching him to somebody. Yeah, it infects immunocompromised individuals, like those with HIV and AIDS. It's opportunistic fungi. Coughing, and it's also associated with meningoencephalitis. So you can be seen with fever, malaise, neck stiffness, nausea, vomiting, sensitivity to light. Interestingly, and this appears on the boards, mucicarmine will stain positively, so that's just like a buzzy thing to know about it. And you can prepare it with the mucicarmine and the methanamine silver stains for diagnosing pulmonary cryptococcosis. Also, India ink staining of the CSF will show those cells as well. So India ink, keep that in the back of your mind. What else do we need to know about this? It can present with soap bubble brain lesions, and the initial treatment involves a combination of amphocytarin B and fluctosine. Other than that, pretty much all we need to know. So let's dive into a practice question here. We've got somebody with HIV. They've got a low CD4 count, and they have inhaled yeast from soil and pigeon poop. So that's just going to be our nice dead giveaway right there. So we got the budding yeast in the tissue with not the hyphae, and it'll spread through the blood to the CNS and cause that meningoencephalitis that we talked about. And you diagnose it with CSF latex agglutination, India ink, or the culture on this agar. And so you see like mucimine. That's going to be really pathognomonic for Cryptococcus neoformans. So let's talk a little bit about how this all works. So you get an inhalation of the yeast. It'll enter into the lungs, and in healthy people, this should be cleared by the macrophages and the T cells. But in immunocompromised hosts, you can't mount a good cellular response, and so the yeast will disseminate in the blood. So that's the blood spreading crossing the blood-brain barrier will cause the meningoencephalitis. And so, yeah, it's got the polysaccharide capsules that avoid the phagocytosis. The India ink will show it, and so will the mucicarmine. It's got the red capsule staining. So let's talk about the other answer choices that you might see on this one, trap answers. So here you can see the candida that's caused like esophagitis. That's common in HIV, but also present with you'd see like the painful swallowing, white plaques in the mouth, budding yeast, and the pseudohyphae, but no capsule, importantly. And pulmonary disease from the crypto. So crypto enters through the lungs, and it can cause coughing, chest pain, lung nodules, but the pulmonary symptoms are like mild or absent. So yeah, probably not that one. Meningoencephalitis is going to be our correct answer because it's associated with Cryptococcus. So that's great. Candida, you'd see like oral thrush. It's common in HIV as well. Mucormycosis, like sinusitis, that's in diabetes with ketoacidosis and severely compromised patients. So that can spread to the brain, causing facial pain, black eschar. Organisms would be like broad, non-septate hyphae, not yeast. And it would definitely not be mucicarmine positive. So cutaneous Cryptococcus, that's very rare, and it would present with papules, ulcers, pustules, but it's less common. So skin disease, not the most frequent presentation here. So hopefully that's helpful. Yeah, that's Cryptococcus. So that's all I got for you.